Good afternoon, y'all. Welcome to the Vent Gen. I want to talk to you about non-invasive ventilatory support today. So we're going to spend some time covering two different non-invasive ventilatory strategies, one being CPAP or continuous positive airway pressure, that would be one pressure, or BiPAP, which would be a biphasic positive airway pressure, which will offer the patient two levels of pressure, supporting both their oxygenation and their ventilation status. So real quick, down and dirty deep dive is CPAP offers one pressure setting that will help to support the patient struggling specifically with an oxygenation status issue. Whereas BiPAP actually offers two pressures, providing the patients with both oxygenation and ventilation support. So what I want to do quickly is just decipher and break down two different types of respiratory failure, which will actually help us make more informed decisions on what intervention's actually going to have a more positive impact on the patient as far as time goes, and helping to potentially turn the patient around specifically in a pre-hospital standing. So you've got type 1 respiratory failure versus type 2 respiratory failure that you can see there up on the whiteboard. So type 1 respiratory failure is simply defined as a low oxygen status, something like an SpO2 that would be traditionally under 92% or 90%, depending on whatever your agency policy guidelines are, low oxygen with a normal or low CO2. So this would, when you get into those staging of like the chronic lung diseases, these patients haven't adapted their CO2 levels to live at higher CO2 levels. So when they get into distress, they still will be able to blow off their CO2. And it's really important to understand the term hyperventilation versus tachypnea. So hyperventilation is actually clinically defined as a CO2 that's measurable below 35 millimeters of mercury. So that being said, let's move over to type 2 respiratory failure. This is going to be a patient that has high CO2 without any presence of decreased oxygen levels. And here are some of the examples of disease processes in each of the types of failure. So on the type 1 side, you're thinking pulmonary embolism, you're thinking early onset pneumonia, and we'll talk, these things, these disease processes that I'm talking about that are traditionally impacted by type 1, when they become more chronic or more prolonged in their nature, they start to shift over into that type 2. So just put a pin in that, because we're going to come back to that here later on in the class. So early onset pneumonia, pulmonary fibrosis, and other interstitial lung disease processes. And pulmonary edema, which would be secondary to CHF only, or something like a dry drowning. So maybe the patient was in a near drowning event on the beach, especially like from salt water. We live down here in Florida, so we see a lot of this stuff with these near drownings. And when this happens, maybe the patient's been resuscitated, they go home, they go to sleep, and all of a sudden there is this flash flooding or pulmonary edema that occurs that we call something as a dry drowning, where the lungs are filled with pulmonary edema and we cannot perfuse oxygen across the alveolar capillary membrane. And then your chronic lung patients, like your COPD patients, emphysema, chronic bronchitis, things of that nature, these are going to be your stage 1, stage 2 patients, even like your asthmatics. On these chronic obstructive or obstructive lung disease patients, you got to catch them early on. And what typically happens in the pre-hospital space that we see with our rescuers is by the time these patients are calling us and asking us to intervene and to help them because they can't breathe, they usually have gone past the point of no return, and they're actually moving towards that type 2 style of respiratory failure. So they're going to need support in both their oxygenation status and their ventilation status. So this really prompted me to develop this educational design and this educational video for you guys today, in deciphering that we have a large gap in that pre-hospital space where most of our agencies and services, they have the ability to provide disposable CPAP, which is under high pressure oxygen delivery sources that most of the time have large leaks and can't really control the high amounts of fractional inspired oxygen that they're delivering to the patients. And then they have a pneumatically driven mechanical ventilator that occasionally tries to deliver BiPAP. But again, usually these pneumatically driven ventilators are also pressure triggered ventilators. And what happens in these BiPAP settings is they usually can't overcome the leak or the actual flow drive and flow desire of the patient to keep up with the patient. And secondarily, they're usually dysynchronous with the way that the patient actually desires to take their breaths. So what we want to look for is actually utilizing devices that are flow triggered, that can be utilized in CPAP at low or no amounts of FiO2, so 21% room air, and kind of working our way up, or moving into a BiPAP style. So that being said, this was just a quick video that I wanted to do for you guys to help you decipher when you want to decide using CPAP versus BiPAP. And if you don't use BiPAP in your agency yet, you definitely want to get connected with your logistics team or your clinical education team and start looking into the options that are out there for devices that actually offer BiPAP. So for example, a lot of my teams actually work with a device called the Hamilton T1. The Hamilton T1 is a full-fledged device that will actually offer every single modality of ventilatory support outside of an oscillator. So it gives the rescuer the ability to provide high flow nasal cannula, CPAP, BiPAP, and mechanical ventilation. Not to mention, it can also be utilized in both cardiac arrest and non-cardiac arrest resuscitation with an automated CPR ventilation mode that can be set accordingly to your agency. So if you have any questions, go ahead, write down the comments down below, hit the like and subscribe button, and you can get in contact with me at theventgent0405@gmail.com, or you can find me on Twitter at theventgent0405. I'll see you guys out there on the road.